Hi, everyone. We're going to get started here. Yeah, that was a lot. My name is Katie Davies-Jurgensen, and I'm the Chief Operating Officer at Away Home Canada, which is a national organization focused on youth homelessness solutions and transforming policy planning and practice. We would like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on the unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters on which we gather today. Tiohtià:ke, Montreal is historically known as gathering place for many nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. This session is From Care to Home, Reimagining Pathways to Prevent Youth Homelessness. And without further ado, it is my pleasure to welcome Dr. Melanie Doucette, Adjunct Professor at McGill University School of Social Work.
Time myself because 20 minutes isn't a lot. So today I'm going to be presenting to you a Photo Voice project that I was supposed to do as my postdoc actually in 2020, but the pandemic kind of kiboshed that. So I ended up staying in Montreal, and a couple of years later, I was asked to supervise a PhD student to do it on the ground in Halifax because I had actually done all of the legwork. I had gotten the ethics approval done, all of that prior to the pandemic kind of kiboshing the project. So we did this together, and I went to Halifax a couple times to meet the youth and to also take part of the photo exhibit that we did at the Halifax Public Library at the end of the project. So I'm going to talk a little bit about what Photo Voice is, and I also want to emphasize that I choose this particular methodology in most of the projects that I do because it's truly collaborative. I am a person with lived experience in the child welfare system. I also experienced invisible homelessness when I aged out at age 19. I'm originally from New Brunswick, but now I live in Montreal. And I have this lived experience lens in everything that I do, and I love to co-create with other people that have lived experience because I think it's us that should be telling governments how to change their practices and their policies and their supports. And I find we're often missing at a lot of important tables, including academic tables as well. So this is kind of my way to try to bring those voices to the forefront in research. So like I mentioned, I led this project in collaboration with a PhD student from Dalhousie University, Elizabeth Clark. She's not here today, but I'm presenting on both our behalfs. I also want to acknowledge the co-researchers who contributed to this project. These are the names that they chose to go by. Another kid in the system, Haley O'Neill, Nick Roca, Perseus, Riley Lucas, Celinda V, and Shayla Lorenz. And this project was supported and funded by the Resilience Research Center as well as Making the Shift. So I want to give a bit of a background very briefly on why examining the experiences of youth aging out of care and who have experienced homelessness is important. We're overrepresented in the youth homelessness population, and it's a systemic result and very much preventable, in my opinion. Homeless youth are actually nearly 200 times more likely to have been involved in the child welfare system, and this is Canadian data from the 2015 and 2019 National Youth Homelessness Survey done by the Canadian Observatory on Homelessness. So 61% of homeless youth have identified that they were in touch with the child welfare system and have aged out. And there's a much higher overrepresentation of these youth as well in terms of intersection with LGBTQ2S plus youth and Indigenous youth. Their overrepresentation is even higher. So like I mentioned, I like using arts-based research methods because it allows for this co-creation to happen. And it also allows for conveying messages that youth might not necessarily have the words yet. Because I find sometimes when we sit young people down and we're asking them to share profound reflections about their experiences, they haven't even been given the time or the space to actually sit with what they've gone through. They're usually in constant survival mode. So I like doing these types of projects where it allows for that space and time to be able to reflect on past and current experiences. So using photography as a tool for research, it really allows for young people to show literally their lens to the outside world. So I really enjoy using this methodology. And because it's grounded in participatory research, the co-researchers get to control the narrative that gets put out there. So they're representing their own lived experiences instead of kind of the traditional way of doing research, which is very extractive, isn't very reciprocal, to be quite honest, and oftentimes not very empowering. And it also engages key decision makers and politicians and the public in the process, because at the end you get to do a photo exhibit in the community and you can talk to the media and you can do all kinds of presentations. So it doesn't just stop at the end of the data collection phase. So just to give you a quick profile on who was taking part of this study at the time, there mostly were, in terms of gender identity, 5 who identified as female, 1 as non-binary, and 2 males. We had a lot of young parents, actually. Half of the group were young parents or young parents-to-be at the time, and their age range was between 19 and 26, with most being between 24 and 26. In terms of ethnicity, we had 3 who identified as Indigenous, 1 as African Canadian, and 4 as Caucasian. And all of the youth were connected via the Phoenix program in Halifax, Nova Scotia, which is a community-based organization that provides services to marginalized youth. These were the research questions that we wanted to look at through the photography, and we solidified these together at the beginning of the project. So we wanted to look at the risk and protective factors that influence whether a young person will be experiencing resiliency or if they will be experiencing homelessness. And we also wanted to make sure that we were formulating recommendations and solutions for policy and practice. That's another thing I feel really strongly about, is that research has the power to influence change in the child welfare system. And when it comes from a lived experience-led perspective, even more so. So the findings were thematically analyzed. So we did actually the thematic analysis together. It was embedded in the structure of the project. So we were actually teaching the young people how thematic analysis works and how you can come up with themes. So we came up with these 4 overarching themes: protective factors, dual protective and risk factors, which is kind of unique because there were some factors that were both a protective and risk factor depending on the context. And then we also looked at risk factors and then recommendations for practice, policy, and supports and services. So for the protective factors, these were the main ones that came out: comforts, hope, community, and self-care. Today I'm going to focus on the community one. So I'll share a photo that was submitted by another kid in the system. They titled it Flowers. Getting to where I am now was a true battle I fought every step of the way, sometimes with some help from a friend. The yellow flower was gifted to me by a tutor when I graduated from my program at NSCC, which is a community college in Halifax. The pink flowers I bought for myself. So this was grounded in the community sub-theme. A lot of the youth mentioned personal heroes or champions that were in their life that chose to go above and beyond their job description or professional role to really make a difference in the lives of the young people. And sometimes it wasn't even people who were paid to be in their lives. It could be like a school counselor or a bus driver, people who work in community organizations, municipal employees that they encounter. And these people took on roles that family members would traditionally take on in terms of like protectors and advocates for them. And they felt that these people actually helped them feel hope and connect them to resources that they were able to get out of homelessness. Another component from community that came out was tent city, what they called tent city, so encampments. And they actually felt a sense of community there. So that was actually a protective factor for a lot of the youth. And they said that they felt more of a sense of safety and inclusion in tent city than in a homeless shelter or even in their foster family or a group home. So that's something important to think about when oftentimes cities will go in and just dismantle completely tent cities without thinking of the community that's been forged there. In terms of dual protective and risk factors, today I'm going to focus specifically on work, but space was another one where it really depended on the space and also sometimes even the time of day. So sometimes a certain space would be a place for safety or to take shelter from the elements, or sometimes a space would be really dangerous and a place where they could either be assaulted or they called it at risk of being disappeared. So some of the spaces that they mentioned that were safe, public benches, coffee shops, tent city, public staircases, movie theaters, which a lot of them said during the holidays, those are often the only times that they have somewhere to go, and also friends' homes. Some hostile spaces that they mentioned were entrances or lobbies to public buildings, harsh outdoor elements, and homeless shelters, which oftentimes were adult-focused and were actually really dangerous for them. They would get their stuff stolen, they would get harassed, assaulted, and so on. So interestingly, work was actually both seen as a protective and a risk factor. This was taken by Haley O'Neill, and she titled it, "Why Don't You Get a Job?" I always worked. I would show up for work at the mall on time every day and work my ass off, and this other girl would be late and say her alarm didn't go off. But she had a home with a bed and an outlet to plug her phone into, and she couldn't show up on time. So a lot of the youth were really frustrated because most of them were actually employed while they were homeless, 6 out of 8. And they just did not make enough money to be able to afford rent. And the rent in Halifax is actually astronomical. It does not match at all what the salaries are or what the pay rates are. And there's a big housing crisis that's happening there. And for youth leaving care, they don't have savings. They don't have a credit score. They most likely don't even have employment experience. And they don't have a family to call and say, hey, I need some rent money or some grocery money. So really, they're kind of set up to fail and set up to be homeless. One young person expressed really like a lot of frustrations about this kind of concept that homeless people don't have a job and they're lazy. And she said, I did everything right. I pursued my college degree and trades education right after high school. I got good grades. I worked hard. I worked while I was in school, and I still didn't make enough to afford a place. So again, it's like kind of these stereotypes and preconceived biases around homelessness that follow them and sometimes prevent them from accessing the supports they need. In terms of risk factors, there's a bunch that came up. Intergenerational experiences
All the youth who took part of the project actually had intergenerational links to the social services system. So they had parents who either struggled or still struggled with homelessness, parents who struggled with addictions, mental health issues, suicide attempts, and also experiences of domestic violence. One youth also had a child who was now in foster care, so they had intergenerational foster care happen to them. Domestic violence was also another big one, which I'll talk about in the next slide. Mental health and substance use was a big struggle for a lot of the youth. 7 out of 10 were struggling with this. And it wasn't just like substance use in terms of taking substances. It was also the side effects of mental health medication that they were prescribed. And sometimes they felt it was hastily done. They didn't really receive any follow-up. The doctor wasn't really taking time to like really learn about what was going on. And so they felt they were like on this random cocktail of drugs that would help them or not help them. They also had a lot of struggles to gain access to mental health medication that they were prescribed. So oftentimes, young people, when they age out of care, they lose health coverage that's usually provided by the system while they're in care. And that means no money for your mental health medication. And it actually can cause you to enter into psychosis or to like mental health crisis. They also talked about feeling like their minds were different from the rest of the population, and that that was for like various reasons, but a lot of them felt that it was because of the impacts of all the trauma that they experienced. Negative self-image was also another risk factor. Half of the youth co-researchers talked about this, where they felt this sense of unworthiness of support that resulted in them kind of temporarily giving up and temporarily not seeking to have supports. And this is something that was kind of ingrained into them while they were in the system. And I'll explain a little bit about this under community apathy as well. So this is an untitled photo by Shayla Lorenz, and it's about domestic violence. 6 out of the 8 youth co-researchers experienced domestic violence. They either became homeless or criminalized because of ongoing violence against them, or it happened while they were in their parental home, and that's why they got placed in the system. One youth co-researcher shared that they stayed with an abusive partner just so that they wouldn't become homeless. So it was kind of choosing one thing over the other and at their own detriment. And another co-researcher disclosed that they were actually charged and convicted of assault on their partner after experiencing months and months of physical and emotional abuse perpetrated by their partner. And they felt like the police wasn't really paying attention to the dynamics of the situation. So one of the youth shared, "You shouldn't have to stay with someone just to have a place to stay. I lost my son into foster care because he was violent and I had nowhere else to go. The police just come flying in with no idea what's going on. If they would have looked him up for just 1 minute, they would have seen that he's hurt me so many times, but instead they arrested me." This one has to do with community apathy. It's called Trash by Nick Roca. How the world views you when you're homeless. This was identified by pretty much all of the youth. They said there's a general lack of concern from society, but also even from their workers. They said when you're out on the streets, it's like they can't see us or they won't see us. They just pretend that they don't see us. People are just too busy kind of doing their own thing and don't pay attention to you. They also constantly fear acts of hostility and harm for being on the street from people because of this apathy. And they also felt that while they were in the system, they were treated differently by foster families compared to their own biological children if they were in that type of placement. And they also felt that workers had really apathetic reactions to their risk of homelessness. And a lot of them talked about being dumped at shelters after the age of 16 if their foster placements weren't working out. And this was by their social worker. Okay, I only have a couple of minutes, so I'm going to go straight into recommendations. In the practice realm, the youth said that they want better oversight and vetting of foster families because all of them experience homelessness because there was a placement breakdown. All of them. So they experienced homelessness while they were still in care. They also wanted more consistent social workers, which I'll talk about very briefly in the next slide, and regular check-ins and safety assessments on the family of origin, because a lot of them boomeranged in and out of the system. So they would try to reunite them with their families, and they were going exactly back to the same situation that was there that caused them to be placed in the first place, and there was no check-ins being done, and this situation just escalated from there. So I'll share this last photo. It's called Cell Phone Case by another kid in the system. Throughout my time in the care of Child Protective Services, my social worker and legal guardian changed so often. I was a number in a work phone that was unceremoniously passed from worker to worker. And this was something that a lot of the youth talked about. There was a high turnover of social workers in their lives. One youth who had been in care since a baby said they probably had over 100 different workers over their lifetime in care. And they said there was no really regular, meaningful checks on their well-being, especially as they became adolescents. A lot of them felt they didn't have the proper social skills to interact with people, to be able to ask for help, to be able to have healthy relationships. And they felt that was a failure from the system to not be able to meet certain developmental milestones. And traumatic experiences also, when you have that many social workers in your life, you just have to retell your story over and over and over again. And it felt that was really re-traumatizing and annoying, where, the social worker wasn't really paying attention. So I'm going to stop there because that's my time, but we have a link tree for the project. We have a photo ebook that shows the many more photos that came out of this project and features every youth co-researcher as an artist. We also have a report and also a published journal article on this study as well. So feel free to go read and ask any questions during question period. Thank you.
Awesome. So we have a couple of minutes now for any questions for Melanie. Feel free to come up to the mic and ask away. I think so, yeah.
Hi. It's more a question on the method that they use. So, like, maybe a timeline, what did you use, like, the process.
So in terms of the methodology, if you read the report, it actually gives like the full steps of what was done, but it was actually over 14 weeks. So it's kind of like a course in a sense. We met once a week for 2 to 3 hours. At the beginning, it was kind of like just to kind of get to know each other, determine kind of some safety guidelines around working together. And then they were given photo voice training by a professional photographer who had some experience around photo voice. So they got taught like how to use their phones, or if some of them had digital cameras they wanted to use, how to use like lighting to create a certain mood or message, how to take impromptu photos, how to stage photos, all kinds of tools and techniques. And then in the following weeks, they were just kind of asked to take photos wherever, whenever, for the weeks between the sessions. And then every week they would share 1 or 2 pictures that they took that week that they wanted to share with the group that, of course, like were referring to the research questions. And that's kind of how we started the analysis portion. So they had very specific questions that they would kind of contextualize the photos to the research question. And then at the very end, towards closer to the photo exhibit event, that's when we started to do the thematic analysis to kind of see commonalities across all the photos that were being made. And then from there, we developed the recommendations for policy practice and supports. So yeah, it took about 14 weeks from start to finish. And then we still did some things afterwards. We presented the results to the Department of Protection Services in Halifax. And we also spoke to the media and did things like that. So we still kept in touch afterwards.
I have a few questions. One, do you have like the methodology and the feasibility and everything available somewhere? Two, did you notice improvements in these outcomes after getting to voice these, express these feelings? And three, would you suggest a project like this done in other communities?
Yeah, I mean, I highly recommend doing this type of research, especially in the community. We did do a debrief session at the very end of the project to kind of ask, like, what do you feel you got out of this? Like, what were the benefits and what were some things you would like to improve? And I think we included some of that in the report as well. But yeah, I highly recommend consulting the report. It kind of lays out how you can do a photo voice project. I also did this for my doctoral project. So you can also take a look at my thesis, which literally gives the blueprint, even like what the consent form should look like all of that. But I think in terms of my doctoral project, I was able to stay in touch with them a bit longer than compared to this project specifically. And the youth shared that it was actually a very healing process because, like I mentioned at the beginning, they're often not given that time and space to self-reflect and to process what they went through and to also turn it onto its head and be like, this can change things so that other people don't have to go through this. I think it's, for a lot of the youth, it was the first time they were even given the space and realization that they could do that with their lived experience, and that was actually expertise. So I think there's a lot of benefits when it comes to that, and it also shows commonality, where a lot of young people in care, they feel so alone. Like for me, I didn't connect with other people from care until I was in my late 20s because we didn't have a youth in care network in my province. And that's how I actually became connected to other young people, was that we started a youth in care network, and it creates this sense of community and shared advocacy. And I think that's so important for young people who have been silenced and have been told to shut up. So yeah, I highly recommend doing these types of projects. Just make sure that you're really grounding it in co-creation and try to get someone with lived experience to lead it if possible, because I find that also has a lot of benefits. And it also teaches young people like research skills, photography skills, all this kind of cool stuff that you don't tend to get from just answering a survey. So yeah, it's just so much bigger than just like a data collection process. And we are actually trying to do it nationally. I'm collaborating with Dr. Michael Unger on a proposal where we want to do these types of research projects in other provinces and territories and have that kind of inform what quantitative data collection should look like. So we'll find out next year if we're successful, but I would like to be able to do this with other youth in care across the country.
Okay, last question.
Thank you so much for your presentation, Dr. Doucette. I'm really interested in the social networks of youth and young adults with prior experience in the child welfare system. I'm curious, you spoke about community being a protective factor and the idea that there's elements of community in tent cities that are a protective factor. Did your research get into any specifics on what some of those elements are, tent cities, that were identified as protective factors?
Yeah, I mean, we didn't delve in because that would be like a research project really in its own, but it did come up for quite a few of the youth. And like I mentioned, one of the reasons for that was that they felt the supports that were available, like shelters and things like that, were not made for them. They were made for adults and not for young people, and also were not trauma informed and were actually really dangerous and harmful to them. Where versus in Tent City, they kind of made friends and they had people that they felt were like mentors to them, or more like parental extended family, kind of chosen family structure that they could not like find in formal settings. And yeah, I think that says a lot, where it's like they feel safer in that context than in the services that are available to them. And I think for a lot of them too, it was the first time that they were kind of working together with other peers from CARE. So that whole process of the project was also about creating relationships as well.
Thanks, Melanie. Next up, we have Kat Main, Director of Impact and Evaluation, and Courtney Hick, Chief Operating Officer from Trellis. Over to you guys.
Everyone, I'm Courtney Hick. As Katie mentioned, I'm the Chief Operating Officer at Trellis. Let me know if I check out. Trellis is a fairly new organization. We're a product of a merger between two organizations. One did primarily youth work, the other did primarily family work, and we came together in 2020 to create Trellis. The purpose of that was really to look at how we can serve better across the continuum of a child's life versus just talking about specific areas. When we merged, we really had to look at how do we streamline things, how do we come together as an organization, and how do we start working in a new way and develop who we were. Through that process, we built two streams of services. We found that we were quite clearly working in two different ways, and we needed to find a way to meld those two ways together. So you can see that we have a housing stream. Those are the programs that are more intense. They have higher acuity of the folks that we serve. They are more intervention type programs, and that ranges from foster care all the way up to family homelessness. And then we also have a community well-being stream of our work. That's the area of our work where everyone across just human beings need the supports that are provided there. So that's affordable childcare, employment, education supports, youth programming, things of that nature. And when we looked at those two streams, we found that the folks that were receiving services in our intervention programs weren't actually accessing the programs in our community wellness program. And the reason for that was we were just not equipped to be able to serve a higher acuity. We felt the folks working in the community wellness side of our work felt like they just didn't have the skill to do that. They felt a little bit nervous when they saw behaviors or when people were acting out, that they didn't know actually how to serve them. So we had to dive in and do some real training and do some work with our people in community services in order to be able to serve the higher acuity people that we worked with. The other kind of cool thing that happened when we merged was we were able to look at our data from two different organizations and bring them together. So we had the trajectory of an entire person's life. So we were able to see that we had some of our clients who had received services in some of our really prevention, early intervention type programs at maybe at the age of 10. And then we could see their trajectory just through our organization, them going through foster care, group care, shelter, back into family homelessness, and we could see the cycle happening right before our eyes. And it really put us in a position where we've got this information and we need to start disrupting this system. We've got the tools, we've got the ability, and we need to start interrupting, and we need to start looking at what happened at the age 10 and what did we miss at age 10? What conversations should have we had at that age that led to them going into group care, that led to shelter. And what did we miss in group care? And what did we miss at shelter that perpetuated that cycle? As Melanie mentioned, we know that the intervention and the child welfare system feeds the homeless sector through, whether that's through youth homelessness, but it also feeds right back through to the family homeless sector as well. So we're seeing their children now coming back through and then ending up back into care. So we really took this upon ourselves to say this needs to look a little bit different for us, and we need to think differently about how we do our work. I'm just going to pause for a second. I'll tell you a little story about what really kind of moved the needle for us. So in 2021 and 2022, we lost 3 children in group care. These were kids 14, 15, and 17, all of whom were Indigenous, all of whom were figuring out their identity. They didn't know who they were. And they all died in their beds where they were meant to be the most safe. And they died from an opioid overdose. It shook our organization. It shook me personally. And it really shifted how we started to work and how we started to move. This was a combination of pandemic. It's a combination of everything that you can imagine, but it really put us in a position where we had to think, are we still going to engage in this work? Because if these are the things that are happening in our care, we're obviously not serving in a way that is actually helpful. And we need to really think hard about how we do that. The other thing that was really poignant for us is that every one of those kids, when they passed away, their family came out. Aunties who were very healthy, uncles, friends that they had lost touch with. And when we had asked the question of Child and Family Services, who are these kids' people? Who's healthy in their lives? We were told they had no one, and they were on their own. And we learned very quickly that that was not true, and that family, I won't say that they were lied to or that we were lied to, but nobody was asking the right questions and nobody was talking about what this kid actually needed. What we ended up doing is going back to Child and Family Services and having the really hard conversation. About if we're going to continue to do this work, we need to start doing it in a different way. And in order to do that, we actually need to do some research. We actually need to find out what's working across the country. What can we do? So we asked them to pay for us to hire 2 research teams. One was Indigenous and one was a Western approach, to really look at what was happening across not just Canada, but across the world, and to find something that would work. Through that process, we were able to engage 80 different stakeholders, from youth, families, child welfare workers across the board. Elders were involved in our process, and we were able to come up with a robust project to be able to support young people and their families moving forward. We went back to Child and Family Services and said, we've got this great project that you funded. Now we need to actually start implementing this work. In order for us to do that, we need an additional investment of $1 million, which of course they turned their nose up to and said, we can't possibly afford doing that. So we had the hard decision to make of, do we just get out of the business altogether, give them our work and say, you need to figure this out? Or do we go back to community and we ask community to support us? And that was a decision that we made. And luckily, we had a very generous donor come to us and say that they would fund an additional $1 million for us to start doing this work. And what we did through this project and what we learned through this project was that the system was working exactly how it was designed to work. It was doing, getting kids, keeping them safe in a house, feeding them, giving them everything that they need, but they were missing the entire component of the human being. And that's really where we wanted to focus. So the key additional pieces that we wanted to add to our programming were around case management, but not case management for the child necessarily, but case management for the family. Understanding that kids, regardless of who they are, keep going back home. They keep finding their family and they keep going back. We wanted to ensure that when they were going back, that they were going back to a safe place and that the family had the tools that they need to heal and to grow and to get to where they needed to be. We also needed to embed some additional cultural connections for folks, some mental health supports, reduce financial barriers for families, and then also improve the system collaboration. We didn't want to do this work in isolation. We're all doing the same work. We all are working with the same kids, and we need to work together in order to have an actual impact. So that work, you can see here, we were working with the child, putting all of our efforts into that young person, but we were neglecting everything else about that child. We were not seeing them as a whole person. We were seeing them only as the person in our program. So we really started to expand those pieces. And in doing that, we had to start educating some other folks about how we were doing that work. We needed to start collaborating in a new way, and we need to start bringing new supports into place. We were able to embed, like I mentioned, the case managers. So every child has a case manager along with their family. Every child and family has access to clinical supports, whatever that looks like for them. They also have access to cultural supports. So we were able to bring elders and circle keepers on board, and we were able to see some change happen there. The biggest piece for us is we got super excited. We got this $1 million, and we just jumped right in, and we were going to make all these changes and just simply embed them into the programming and then move forward with that. But we learned very quickly that we needed to take a step back and pause because we had to bring some folks along with us. Children's services needed to get on board. So we did some advocacy and we did some work from the top, our CEO, right down to our frontline staff, really educating people about what we were trying to do and create partnerships with them. In Calgary, our experience was quite conflictual with children's services, and they had felt like they had their own job to do, we had our job to do, and they should never mix. And we did some work, and we found that the executive teams and the leadership teams within children's services were very on board with this kind of work. They could see the benefits of us moving in this way, but to filter that down through a giant system to those frontline staff wasn't easy, and it took a little bit more time for us to get to that place. But we're in a good place now, and we're starting to see some movement forward. I'll pass it on to Kat to give you those details.
Thanks, Courtney. I'll apologize, I'm just getting over a bit of a cold, so if I pause a lot, it is purely for the sake of breathing. So, we implemented our 5 key enhancements based on the feedback and the research project that we did that was funded by Children's Services. And this is the first cohort of youth that we were able to apply the new model to. So you can see that there's a high number of Indigenous youth as well as youth who identify as gender diverse. So these are some of our early outcomes. Some of the numbers may seem small, but they're significant for us in the fact that it is the first year. We've had a lot of challenges and learning and growing while we have been building the model. And so this is still a work in progress. So when we first started in 2022, at that point in time, we took some baseline assessment numbers, hoping to be able to compare once we had the model developed. So these are some of those outcomes. So with our first group that we've been working with, we were able to see a 13% increase in exits to stable housing. Lots of this had to do with the increase in permanency planning and planned transitions increased. We had originally had a lot of kids coming into care and they had no permanency plan. And so we collaborated with Children's Services to really nail down something concrete, whether it was family, kinship, or something that we could be working together towards. Another interesting thing we saw was that our AWOL numbers decreased quite a bit. Lots of the kids were AWOLing to go and see their parents. And so under the new model, they could actually talk to us and we would support them to go and visit. So the number of AWOLs decreased, as well as the length of time that they were gone decreased. We did see an improvement in our family reunification numbers, and so we're hoping that continues to work. There's lots of challenges in trying to support the families to get stable so kids can get home, and we'll talk about that in a little bit, how we are been able to support that. One of our biggest wins has been around the engagement of the natural supports. So hiring youth and family case managers, as Courtney was talking about, has really made a big difference. We were able to engage 106 natural supports of the 60 youth that we served, and we formally intaked 18 family and natural supports. And in that way, we were able to add them to the Trellis continuum, and they could access multiple services quickly. This was such a big win for us because so many of these families have so much trauma themselves and distrust of systems. So this really told us that we were moving in the right direction. One of our big pieces of work was enhancing cultural supports within programs. We have a team of circle keepers who go into the group homes on a regular basis, just spending time. They will cook bannock with the kids. Sometimes they'll teach ceremony or build medicine kits, but it's really rooted in the relationship building. We also have an elder in residence who can host sweat lodge ceremonies and provide land-based teachings. And we provide all of these supports to the families as well. The circle keepers will go out into the community and meet with the families, provide support, ceremony, whatever they will need. Some of our families have shared about the impact of these increased supports. One parent told us that her daughter was learning things about her culture that the mom didn't know, and when the daughter would go home to visit, she would be teaching the mom about what she was learning. Our clinical supports also had a little bit of a journey to figure out. We originally thought we'd assign 2 therapists. They would go into the homes, and kids, just by being in the homes, that the kids would access therapy. And we quickly realized that did not work, and we needed a different approach. So we did something similar to our approach with the circle keepers, where now the therapists go into the home and they're just spending time. We have one therapist who has built a relationship with one of the girls by playing guitar with her, and they do their little riff and band together. And through that, he was able to build trust and start having the deeper connections and working on some therapy that way. The families are also prioritized access. They move to the top of our list when they're ready to access mental health. And we work from a right fit model. So we now actually are accessing our full team of therapists, which is about 12 people. They have different specialties and modalities so that we can make sure that somebody gets matched with the person who's going to be the best fit for them. The Burial Removal Fund has probably been one of the biggest game changers. When we were originally getting feedback from families and youth, they talked a lot about the practical challenges relating to being able to connect because of financial difficulties. So we use these funds for everything from paying for a bus ticket for a kid to go home for a visit, or a hotel room for a family to come into town to visit their youth. We will also pay utilities and rent, so the family will have stability when the child goes home to visit. One youth we had, the mom wanted him to come home. She finally got housing, and he didn't want to go home on weekends to visit her. And when we dug in with a little bit of curiosity, we found out she was facing some pretty serious financial hardship, and she didn't have groceries at home. So he didn't want to go there and not be able to eat on the weekends. So we were able to support her not just with groceries, but connecting her to employment sports to try to help her improve her financial situation. We also had another family, a mom and a dad, who wanted to go into treatment, but they didn't have housing. Because of our continuum of housing services, we were able to connect them to housing, and then the mom and dad were able to take turns going into treatment and then have stability with one of them at home, and the children could go home to visit. Courtney's going to round us off.
We wanted to end by just reminding everyone that this is really hard work. You don't need a reminder of that, but that there's always hope at the end of this. And that I think sometimes, at least our experience in Calgary has been, the system is set up the way that the system's set up, and we're meant to work within that system. And when we learned through this project that if we got a little bit curious, if we started to ask different questions, and we started to be disruptive at many different points of the entry point of a child coming into care, we were actually able to make shifts. And what we learned really clearly from one of our elders when we were working on our research project, she reminded us that the system is just made up of a bunch of human beings who really want to do good work too. We want to do good work, and we're human beings. If we start connecting at that level, we can actually make a shift. And we started to embed that into our work. We started to see the change happen. And I would encourage everyone to move in that direction and remind ourselves that we're not fighting against, we're fighting with. And when we get to a place where we fight with, we actually can make some real headway. Thank you for being here today.
Felt like that was sort of a mic drop kind of end. I don't know where we go from here, but if anybody has any questions for Kat or Courtney, please come on up to the mic.
Hi, my name is Steve. I work at Youth Without Shelter in Toronto. My background, though, is in children's mental health. And I worked residential, and I ran residential treatment programs. One thing I want to touch on, when you looked at your AWOL rate, right? Everyone loves AWOLs. I really think that what you're seeing is, were they running away from something, or were they running to something, which is a big differentiation. So hats off. I worked a very similar model years ago, and the success rate was astonishing. Nothing will be perfect. Your numbers, you may see them as small, but when you extrapolate that over hundreds of kids, you've made a significant difference. So hats off to you for really looking at what you did. That's a great job.
Thanks, Steve.
Thank you so much for the presentation. My question was about, like, how did you pass from, like, finding the key points of entry of what is the situation to build that really super efficient KPI system, and like kind of being, okay, well, we're going to target these and we're going to be able to like move this from there, right? Like this, how did you from the research went to like organizational model of KPIs, etc.? Yeah.
It's a great question, and it wasn't easy. I think we had some basics, and we worked with the consultant team, both the Western and Indigenous teams, to kind of try to identify that. And right now we're starting to get some good quantitative data, but there's also some really rich qualitative data that we're trying to figure out. We're trying to invest in more oral storytelling with our circle keepers and elders to try to capture some more of the impact that way. But working with the team we said, well, what are some basics we want to see? We want to see increased connection to culture. We want to see increased connection to natural supports and mental health. And we've definitely had to shift how and what we're counting along the way. Like, for example, with the mental health therapy, just counting number of formal sessions didn't tell the full story of the actual work that was happening. So it's really been evolving, and part of the research project was a developmental evaluation. And so that was trying to help us kind of fine tune what some of those indicators and KPIs. And a year from now, they may not be exactly the same because we'll have figured out the best way to kind of capture what's happening. Does that kind of answer?
Hi, thank you for the presentation. I just had a question about, you were saying that prior to the model being implemented, it was more like seeing the participant as just someone within the organization, not really looking at the person as a human being. What were the strategies maybe internally that you guys did? Because I noticed that after the model, it was more like a lot of personnel was mobilized to work together and to help the community. But internally, what did you guys do to transition from that, this is someone within the organization, to like, this is a human being, like this unique human being and this other unique human being, like going to this like individualized approach. Sorry, I'm stuttering a bit.
We know that change management is challenging and trying to get people on board. We did a ton of going into programs and having one-on-one conversations with our staff. We did a lot of training, and it's really in that reflective practice, embedding that with our staff team. And honestly, we had a lot of grit, and we just kept pushing forward, and we kept challenging some of the old ideas that our staff had, and I think that the education system had sort of perpetuated, the system perpetuates, and we all sort of perpetuate. When you work within a child welfare system, we're exceptionally risk adverse. So we don't want to try new things, and we're afraid of getting into trouble. We're afraid of what the consequence is going to be. And we started to eliminate some of those pieces. We started to make mistakes, own those mistakes, and talk through what those are. And that happened at all levels of the organization. And we really were working towards empowering our staff to play a little bit, try new things, be excited about what you were trying, and then adjusting, not punishing, but shifting people to go back into those places, and celebrating when things worked really well, and also celebrating when we made mistakes, but we learned and we changed. So doing all of those things, and it's ongoing. It has never stopped.
I'm just going to add one.
Little comment. I'm asking the question because it's, in the field, when the clientele outnumbers the workers by so much, it's very hard to precisely use this individualized approach. Sometimes you have to just use shortcut just to be able to help everyone, but sometimes that's not even a good solution. So I was just curious about.
Yeah, no, I would say it was really the challenges around supporting people to think in the gray, because sometimes it's, well, what's the rule? What does the policy say? We'll just do this in this situation. And this new model really creates space for a curiosity mindset, but that's really challenging when you're kind of working with a system that does have a lot of boxes. Another thing was that this also kind of happened in the early years of our merger, and we were already in the mindset of how do we use all of our services a bit more holistically for the most complex clients. So there was a bit of synergy there in terms of how we were already reorganizing the organization to provide more wraparound supports.
All right, thanks. Thanks, Kat and Courtney. For our last session, we have Dr. Patrick Stewart from many places, I hear, but Luma Native Housing Society, and Joe Derrick from Gixtan Child and Family Services. They can more fully introduce themselves.
Good afternoon, everybody. My name is Joe Derrick. I work with Gitsan Child and Family Services, which is a Indigenous child welfare agency in northern British Columbia. And so I'm just going to give a disclaimer that I'm not a practitioner. I'm a finance guy that got roped into this because a couple of our people weren't able to make it.
I'm Hilu Smoyet Savak. Patrick Stewart is my English name, member of the Niska Nation. And Joe and I are not social service workers, so working in that area, we work with an organization providing support services, I suppose. My training, I'm an architect, and I've been working with Gitsan Child since 2017, I think, when we first connected. As a disclaimer, I was born homeless and grew up in care. And the last thing I wanted to do was work in social services. But I came back to it, I guess, through the work I do as an architect. And it's been great that way. Acknowledging that the unceded traditional territories of the Kanesatake, Haudenosaunee, and Anishinaabe people on whose land we're meeting today, and who we are. Joe introduced himself, but there's a fuller bio, I guess, on him. And that is me as well. And we are here because of Gitsan Child and Family. And that's just a map of British Columbia showing where the Gitsan territory is. And GCFS, Gitsan Child and Family Services, as Joe introduced, is an Indigenous child welfare agency in British Columbia serving 5 First Nations. And the kids are Gitsan, and there are quite a few Gitsan children that are not living in the territory. And that was sort of the impetus when I got involved. There was, I think, Joe and the executive director and a couple others came and we met. And they were sort of in a crisis at that time. They had just lost a teenager, and who was in care but in Vancouver and away from the territories. So that was not the first youth that they lost, and it was impacting them at home, and they said, we've got to do something about it. So you'll notice on the slides it says bringing our children home. That's sort of what they're wanting to do, is bring the children home. And if you look at sort of just in BC, when you look at the numbers of kids that are in care, it's crazy. And when you look at the number of kids that age out every year, it's, depending on whose numbers you look at, but between 700 and 1,000 kids age out every year. And what happens to those kids? The problem is, and this is the numbers that we've been working with, is 50% of them end up homeless. And push the button. And so that's the kind of context that Gitsan Child is finding themselves in. So when you ask yourself, what can we do, right?
And so Patrick talked about so the children, Gitsan children that are in care. And so I think when we look at our numbers, I think there's something 150 Gitsan children in care across British Columbia. And when we look at the children that are in our care, our agency's care, it's less than 20. So the overwhelming majority of children, our children across the province, are far away from territory. They're in Vancouver, they're in Prince George, elsewhere across the province. And so Patrick talked about the project where we were able to, what did we want to do? We want to make sure the children are close to home, they're close to family, because no matter what, for us, for Gitsan, doesn't matter where you are, doesn't matter how old you are a child of somebody. And doesn't matter if you're infant to 90 years old, 100 years old, whatever, you're always going to be a child of somebody. And within our traditional system, it's basically you're going to be a child of your house. And so the importance of making sure children are going to be back home with family is incredibly important for the well-being. And so when we looked at how to sort of bring our children home, we managed to get funding from a source, and we're working with Patrick to create what we called our first longhouse. And it's I don't know, I guess traditional child welfare terms, a big portion of that is going to be a group home, but it's a home amongst one of our villages. There are housing units for youth that are independent living. There are units for strengthening families programs where we can provide stable housing and wraparound supports for those children in care, for those families, as well as children who are about to age out of care. And so that was our first project, because we ended up having to expand our mandate. We were just a traditional child welfare agency for most of our existence. And then I think in 2020 is when we actually changed our constitution and bylaws of the society to expand our mandate into housing. And so we're also working on building more of these projects in other villages. So right now it's in our community of Sigurda, but we are looking at bringing the same, I guess, replicating the same services in our other villages. So, and so some of the things that we've been doing on an ongoing basis with children in care are welcoming them home back to the home territories, because these are children that have been in the system that have not been, in many instances, have not been home, and maybe even their parents have not been home to the home community.
So thanks, Joe. Welcome home ceremonies are like a week culture camp that they do, and they bring the children and the caregivers, and they come back to the territories. And they've been doing that for a while, and intense week. And at the end of the week, unfortunately, those children have to leave, and they have to go back with their caregivers back to where they died, and that's been very hard. And so that was sort of further impetus for GCFS to say, we got to get these longhouses built. We've got to bring kids home. So and as Joe mentioned, there's different facets when you're in care, and when you're aging out. So in the past, supports ended when you were 19, and that's no longer the case. So since 2022, CHRT 8 and CHRT 41 have been orders on the government of Canada to provide wraparound supports for children in care and those aging out. So that's something that Gitsan Child has really supported and been developing physical assets. So making accommodations for those youth. And most recently, as you know, post-majority support services are now available. And so that the way that sort of transpired, or the way that looks for Gitsan Child, it's off-reserve housing. So longhouses that we've been developing are on reserve in the communities. The post-majority tends to be right now. I don't think we've talked about on-reserve post-majority, but have been developing off-reserve housing. And it's, wraparound services. So when we started to look for money to do this, and talking to places like ISC, Indigenous Services Canada, sorry, they don't provide housing. And we thought, well, you guys have CHRD 41. They said, yeah, but that's not the lingo you use. You can't say you want to build an apartment building. You have to say you want to provide 24/7 wraparound services. And that was a new sort of way to talk. So we had to learn that to meet the funding requirements. And when you look at what the details of those two orders are, it does allow GCFS a lot of flexibility in programming. So Joe has been heading up the capital projects for GCFS, and busy being, I guess, a developer in a sense, because they're always looking for property to buy, houses to buy, because there's such a need, and there's no, the communities are rural and remote, so there's not a lot of stock out there. And one of the things that we didn't consider when we were looking at these projects and building projects in the communities is, what about staff? These are remote communities that are not near town or an urban area. And so for Gitsan Child staff even, there's a lot of driving. Social workers are driving from the nearest town, which may be Terrace or Smithers or Hazelton, and they're driving an hour in the morning and an hour in the afternoon to go home. And it's not leaving a lot of time in the communities. So GCFS said, we got to get our staff out in the communities. So this in the upper right picture is what we ended up with in Sigaduck, and that is as a group home for 6 youth in care, 6 youth agreement youth, and 3 townhouses for Strengthening Families program. So that's where GCFS has identified a family that, instead of having them fall apart, they can bring them and have them stay here in a unit, and their staff supports around them. And that's sort of the intent here. And that's an idea that they are thinking they want to do in each of the communities. There's 5 communities. So when you look at the amount of work And don't forget, this is a social service agency, and now they're landlords, and now they're having to fix things, and now they're having to, just, they have a fleet of vehicles because they're so dispersed in the Hazeltons. They've got many vehicles always on the road. They're always having to maintain, and again, somebody has to manage, coordinate, all that stuff. And the more we've been working at it, the bigger it's been getting. It's like a spider web, it just goes. And right now we've got, I didn't have any pictures of it, but they're very excited and ambitious organization, and they went and they bought a building, and they were hoping to turn it into offices, and that's what we're doing. But they went and they bought that building and said, look what we did. We bought a building. And it was a 40 or 50-year-old building, wood frame, and it was in need of much work. So that's something else that we're having now to do. And the most recent thing, I think, is the warehouse that all of a sudden they had to rent a big warehouse because so many goods that come and go for the longhouses, for the programs. And again, that's something else that they hadn't anticipated. So, yeah, it just goes. But when you look at the work that needs to be done for a project, it's very detailed. And there's community meetings, project team meetings, there's documents, there's MOUs, there's meetings with funders, there's land leases to have to manage, there's lawyers. So when we did Sigadak Longhouse, I think there were 4 teams of lawyers. 4 teams of lawyers in the project, because everybody had their lawyer. Federal government, provincial government. And when they started lawyering up, Gitsan Child said, well, we need a lawyer. So, it sort of goes like that. And then the lawyers have their own meetings, talk about their own stuff.
Yeah, and so the one thing when it comes to sort of creating a project for us, location is a big thing. On reserve, off reserve. On reserve, so off reserve, you can buy a piece of property or you can buy an existing building and do what you want with it. Reserve, basically, it has to be either owned by the community or for us, because our organization is not a status Indian. We cannot own land on reserve. We cannot hold possession over land on reserve. And so in order for us to actually have a building on reserve, we have to go through we have to be able to lease the property from the community. So even though we're providing services directly to the community and we're empowered by the community, we still actually have to go through a community referendum where the community signs off on leasing us the land. And then we go through all the process to actually build it, which includes working with all our funders and all of that. And so right now we're approaching a referendum process with one of our communities to hopefully build the next longhouse. And so it's quite a onerous process, because if it was off reserve, it'd be a lot straight. It would happen a lot quicker. But because of our mandate within our operational mandate for service delivery is that we want to be delivering these services in community. And so even though we are close by to off reserve, it makes a big difference when we are actually delivering the services in community, because we have clients that they might not be able, they might not have cars, they might not be able to to drive to where the service is. It's easier for them to walk down the street and walk a couple blocks over, and then there you go. And so I think that's one of the things why we have, while we're sort of beg, borrowing, and stealing anything that we can for being able to operate in our communities, because a lack of investment over many decades of infrastructure, we're having to simultaneously expand our growing services in the community, but also creating the infrastructure in order to deliver those services on the fly. And so it's a lot of work, a lot of coordination between the practice side of organization, the non-practice side, such as myself and Patrick helping out. And it's I think it's something that's definitely a work in progress, but we're making, at least there is some progress to be made.
So one of the results, I guess, that was serendipitous in this process is that Gitsan Child, when we have all 5 longhouses built, will be the largest employer in the nation. That to happen. But each longhouse takes about 20 staff because it's 24/7, 365 operations, right? So it takes a lot of people. And so there's many steps to go through, and this is a model of the next longhouse that we're presenting to the community of Kispioks. We have an information meeting coming up first week of January, and everybody's anticipating this project. And yeah, it's exciting, past due for sure, and the government does not have a clue what they're doing. We're having to pull them along, and very frustrating working with them because they're using every excuse for delays and, oh, we'll see you next month, or their checklists, every email. Here's the checklist. You got to fulfill every one. But they don't tell us on the checklist where we're at. But anyways. Yeah, so I think that's it. So thank you.
Any questions? I know there's somebody out there. Mandy, good job.
Hello, I'm working in Sudbury with our Indigenous child welfare organizations to not so much create physical spaces, but that's something we want to do. So in the near future, do you have like your recipe book? I see you made a checklist, but if you could make that available to other communities, that would be very, very helpful. Because it's a remarkable feat that you've achieved. And I just want to commend you for, just taking it into your hands to bring housing to those transitioning out of care and currently in care.
I think we're making slides available, are we not?
That's a really good question that I will find out.
Otherwise, if you leave a card or something.
Yeah, and sorry, I was just going to, and so I just want to sort of make note too when you talk about working with other entities. And so one of the great things about let's say with the CHRT 8 and CHRT 41 is basically they apply to not only child welfare agencies like ours, but they also apply to Indigenous communities, bands across the country. And so the same types of funding, like CHRT 8, it's supports for post-majority at actual costs, right? And so it's quite important to distinguish who is eligible. But because let's say in British Columbia, the post-majority supports, if the child or young adult was in care and it's the financial responsibility of the province, the post-majority supports that are available for that young person is very minimal. But when it becomes eligible under CRT 8 and post-majority funded by the federal government, at actuals. So basically, it's the service provider that determines what needs to be done. It's fantastic. That's all I have.
Thank you for the presentation, and I also want to just thank you for showing the whole other side to building these programs. You mentioned like it takes lawyers, it takes architects, accountants, and I think a lot of what we focus in sometimes at these conferences is the frontline work, the interventions, or even sometimes the programs involved, and we often neglect that it takes drivers, it takes cars, it takes infrastructure and coordinators for all that. So thank you for emphasizing that. I really appreciate it. I also wanted to ask in terms of, you mentioned that losing a lot of kids to the urban centers or outside of the community in general. Have you or your organization developed any collaborations, and how do the collaborations work with organizations in those centers to, even if the youth are not back in the community yet, are there ways for them to maintain that connection for visits, for connection with the land or culture in any other ways, or how do you collaborate with others outside of the community?
Yeah, so we talked about our welcome home feast that we have every summer, and then also we do have cultural camps, like I say, for children in care, and so our agency has sister agencies across the province that are agencies for other nations, and then that are in different parts of the province, and then with MCFD, there's still contact. And so when we hold these opportunities for children to basically come home, whether it's however long it is for, those invitations do go out. So it gives to provide opportunity for children to basically return to their home territory.
Awesome. Well, thank you so much to the whole panel for sharing how we can do better by all our young people who are experiencing child welfare, especially young people who are Indigenous. And in the words of Courtney, get curious and start disrupting. Make sure you take all your belongings into the break. Thank you.